Good. And welcome to this webinar. Thanks for joining us. This is a topic that Danielle and I have shared for a long time. What makes the successful specialist successful? In fact, we're out of focus. Is that what makes us successful? Okay, we're back. What makes a successful specialist successful? And it isn't just successful specialist, it's successful general dentist. It might be successful anything. But we're going to approach it from the special standpoint. And how do we know? We know because we visit you. We visited some of you anyway. And as we go around the country and as people come to visit us, as we talk to you, we get an idea as to what's working, what's not. And of course, not to brag, but we've spoken all over the place. We met some of these people
Yes.
In other organizations, which are considered to be elite organizations. So we kind of get what's going on. And frankly, I was there at a time when I may not have been doing all the things that we talk about. As a matter of fact, if you talk with Danielle, she might say that I don't do all the things that I say are successful, or at least I have my lapses. But still, there's a continuous theme that as people adopt the success model, they are doing better. And it has very much to do with what's going on in here. It isn't necessarily do this, do that, do this. Although that's part of it. Part of it is be this, be that. And once you be that, then the other things follow. So this isn't a philosophy course. I'm not going to teach you about that, but we are going to share some of the common things. And what I want you to do is to look at these common things and say, all right, what can I do to move myself up just to the next level? Okay. In some of these areas, you're going to be up here. Some of these areas, you're going to be lower. If you can see my hand, you can't. There's my hand. Okay. And you want to gradually move up because that's what we did.
Right.
That's what I did.
Yep.
You were already there.
No, this is not intended to do all in one day. A lot of this stuff is going to be uncomfortable. But I mean, in order for change to happen, you do have to break out of that comfort level. But as we had said before, the things that we're going to talk about are all the changes we've gone through. We don't talk about or teach or preach anything we haven't done ourselves. But we want to share that with you because we are very proud to be leaders of a very large periodontal group of great specialists that, we work together, we talk together, we go through changes together, and we love to help that. So that's really what we're here for, is to help you get to that level. Again, not easy. It's not something that happens overnight, but you can get there just like we did.
That's right. So here's the game plan. We're going to talk about some of the things, and some of you have attended our other webinars. Some of this is going to be repeated, but I try to rewrite almost everything. So there'll be different nuances. We're going to talk about where you are, where we were, and then we're going to talk about the 10 characteristics of successful specialists. And I've got a bonus characteristic too. And so there'll be some teaching involved, and then we'll talk to you about becoming members of the IDS. Okay, so understand that's what's going to happen. By the way, we have some current members of the IDS on the webinar right now, and that's great. We appreciate your being here, and we appreciate your being members of the group. So let's go to the slideshow. All right, good. So yes, typical warning, turn off your phone. And I should put, I really need a new sign. Shut off all the other windows that may be going on. Yeah, I know Facebook is in the background, but So who's this webinar for? Okay, it's for dental specialists who are tired of feeling like they've lost control of their future and they feel subject to a changing marketplace, but they're powerless to do anything about it. When you're not in control, and I'm not talking about being roughly in control, I'm talking about being in control of your own environment, knowing what your future is going to be, and not being victim. So the opposite of victimhood. Mm-hmm. When you have that, you feel a lot better. When you can control your environment, and yeah, we control our environment. Mm-hmm. We control our environment very well. If you're relatively new in practice, want to build your practice on the foundation of proven success principles, we did have one person who hired us, not just join the IDS, but hired us to help him start his practice.
To open his door. He hired us before he even opened his doors. So we went through the hiring process, the whole thing.
Yep. And so we did the consulting, and he's a very happy boy. Man, doctor.
Younger than you, though.
That's right. A lot younger than me. Okay. And if you're experienced to practice and your practice isn't taking you where you want to go, and you're concerned about having enough money for your child's education or for a better living condition, retirement, doing what you want to do, having enough money to do that, yeah, this is for you too. And of course, it's not for you if you already have your dream practice. Why would you even be here? If you're seeing a steady stream of ideal patients, nah, I can't help you. If your staff runs like a well-oiled machine, definitely can't help you. But if it's not, she can do it. And if you're not open to new ideas, so understand that what we talk about is not what the mainstream talks about. We're a little bit different. And if you're afraid to step out of your comfort zone, we just want you to take baby steps. But, if everything's fine or you don't think any change can be made, nah, we can't help it. So there I am. By the way, that's a new picture. So I'm a periodontist in Melbourne, Florida. I've been in practice for 30 plus years. That plus is getting bigger and bigger all the time. Ellen and I have 3 kids, 4 grandkids, with a 5th on the way. And we wanted to help general dentists. When I became a periodontist at that time, it was to help general dentists improve their ability to deliver top quality dentistry. Now that was in 1978 when I started perio school, and that's when I got into practice. The attitudes have changed. The prevailing attitudes are, well, the general dentist is going to do what he or she is going to do and kind of use you as an adjunct. I never adopted that model. I know that some of you have. I never did. Essentially, I felt that I could be in control and I can help the general dentist. More importantly, I can help the patient. And I've always been there that way. I've always been at a point where I would develop the entire treatment plan, not just the perio treatment plan, and would work with our colleagues in order to be able to establish a step-by-step sequence of both periodontal treatment and restorative treatment so that everybody knew, the patient knew, the general dentist knew, or the restorative dentist would know, and all the specialists, that essentially I set the treatment plan. And I can't tell you what that does in order to be able, it's not even on one of the top 10 qualities of the successful specialist, but by developing the treatment plan, even though the restorative dentist, and I know there's some prosthodontists on the line, even though the restorative dentist might have other nuances, at least I was setting the framework, and then they could change the framework based on what they felt was necessary. So if step 10 needed to be in step 11, or step 8 needed to be deleted because there was some better idea, at least I established the framework, and then they could plug in what could be in that framework, and then I'd redictate it based on the consultations that I had with the prosthodontist, orthodontist, endodontist, general dentist. But by establishing the framework, that is the idea of becoming the director of dentistry. It doesn't mean we don't listen, as I said, but at least we established framework. So, but things changed since 19 early. So, okay. So yes, referrals are declining, practices are leveling off. There are a lot of people who are tired of the referral runaround, and I was certainly tired of the referral runaround, particularly prescription surgery. And often it was they wanted me to do things that I didn't feel comfortable doing because I didn't think it was necessary. Yet they'd taken a course, and therefore it was necessary. And, was the staff running me ragged?
Yes, they were.
Until Danielle came, and then everything settled down. Okay. So over the past 15 years, we've talked with a lot of consultants, and they were all helpful. They were all helpful. But nobody was doing the model that we were doing, or at least there was nobody teaching the model. And there are others who did that model. I mean, I certainly followed others who did our model. By the way, I used one general dentist as a consultant as well, in order to be able to see how that model works. But a lot of time, a lot of money, a lot of travel in order to be able to get us to the point where we are right now. And so by doing that, we identify the obstacles, and they helped us identify the obstacles. We created solutions, but the solution was unique for the periodontal practice. And now we're saying the solutions that we have come up with are actually applicable to any practice. But it's got to be an upper level practice. It can't be somebody who's just trying to get the machinery going and just deliver without looking at quality. And certainly, even with the restorative dentists that might be interested in what we're doing, it's to work with specialists, work with top specialists in order to be able to deliver top work. That's where we are right now. And so it did produce results. And that's why we feel qualified to share this with you. And that's why we've been doing this for 5 years. Yeah, 5 years. Okay. So now I can concentrate on what I like doing. My schedule is packed. Even this summer, I worked almost all of July.
This is the busiest July we've ever had.
Wow. Stress-free, happy, and productive team. And our stats rise year after year. So we started with a consumer book, and that's the Ultimate Mouth Manual, 272 pages, and essentially gave our patients my philosophy on what to do in every aspect of dentistry. And first edition was good, second edition was better. This one's really good. We've covered more and more procedures so that people can read in 500 words about the procedures or why we do the procedures, why we might not do the procedures. And I'm surprised the number of people who actually read this book.
Yes.
Our patients who read this book.
From front to back.
From front, yeah, amazing. Okay, in 2014, Danielle and I got our consulting legs. At least we adopted those in 2014. We wrote this, which is available in loose leaf, The Perry Dilemma, How to Thrive Now. And it talks about all the practical things that we do and did at that time in order to be able to get where we are right now. Last year, we wrote this book, Advancing Your Specialty Practice, which essentially is a philosophy piece on what you need to do or how you need to be or how you need to think. There are also some practical ideas there. If you want that, we have that book available to you. Just let us know. I think with shipping, it's about $20. In fact, it's not about $20. It is $20. So if you're interested, just let us know. Write to leah@directorofdentistry.com, and we'll get the book out to you. Okay, so some people actually thought we knew what we were talking about. So the AP brought us to San Diego and Boston. We spoke to the NASP core group twice, including last May. Seattle Study Club twice. We've been pretty much all over the country. And we've spoken, or at least I've spoken at 5 different universities. So it's exciting. It's neat. I mean, at this stage of my career, to be able to say, listen, we've adopted philosophies, worked for us, and other people are interested in hearing what we have to say. That to me is a big thrill. Okay, so I'll ask the question, is the quality of patient declining? Okay, you've got your own answer to that. My answer is no. The quality of the patient that we're seeing is improving. In other words, the patient comes to us, and it's not every patient, but the patient comes to us motivated, and there's a lot of full reconstructive dentistry that we do here. Now, not everybody needs full reconstructive dentistry. Some people just need a soft tissue graft, or they just need a crown, and they need something like that. And of course, some of you know that my son is a restorative dentist. That's Dr. Matt Sheldon. We got Dr. Sheldon Furtado, who's a board-certified periodontist. They're doing all the work right now, and to have that team working together is great. But the way we started was that it was me, and I was getting patients in off the street, including those who were being referred. But then we were getting people off the street as a result of some marketing we started in 2004 and gradually learned how to externally market. And then I was choosing the restorative dentist. And I'll tell you, when you can choose your own restorative, well, you tell me. If you were able to choose a restorative dentist for every case that you're treating, how would you feel? I can't even see you, and I can see you not again. Are ethics in dentistry declining? And some people will say yes, and I'll say no, because I'm able to control the ethics. And assuming that my ethics are high, and I think they are, that our standards are high, and then we don't let things go, then in fact, whatever is happening out there is happening out there. It's not happening with us. And so we can control patient outcomes, and we can make sure the patient is happy.
Yes.
But here's a key, and that is, are you limiting your own skills as a diagnostician? That's a big key. If you're a specialist, the first thing you learned was diagnosis, not how to do a crown prep, not how to do a buildup, but or certainly not how to do periodontal treatment. But you learned how to diagnose, and you learned when you're in school. You learned the entire case. You learned what was necessary. You remember case conferences. Okay, case conferences didn't concentrate on what was going to happen on tooth number 24. It was how to evaluate the full mouth. What's going to happen orthodontically? What could be done prosthodontically? What can be done periodontally in order to be able to make things work? Um, but now, some of us, or maybe some of you, are being limited in your diagnosis because you don't want to tick off the referral source. So if the patient is referred to you only for that one thing, whatever that one thing is, you just look at that one thing and you ignore everything else because the referral source told you to do that, and you don't want to tick off the referral source. Our obligation as specialists is to look at the entire mouth, particularly periodontists, prosthodontists, and orthodontists as well. Endodontists, you could, but that's not where you are. But it is full diagnosis, full treatment planning, and letting the patient know that there are other things besides what is involved on this tooth right here. So if you're limiting yourself as a diagnostician, you're actually hurting your patients. And frankly, if you improve your diagnostic skills, or at least feel free to practice the diagnostic skills that you all learned in residency, then you're actually doing something for the patient, and you're doing something for the restoring dentist as well, and the referring dentist, because you're saying, I see this, and this is really important. I want you to talk to Dr. So-and-so about this, and then you write that in a note. Okay, important stuff. In fact, if we want to talk about the one key to being a director of dentistry, is to be a full diagnostician. Treat every patient the same way. Do the same examination procedure on every single patient, not limited exam, full exam. Even though you may only be treating this, that doesn't mean that we don't do a full examination. So if you're limiting yourself by doing prescription surgery, you're not there. And we think you can graduate to something a little bit better and never offend the referral source, okay? Because we know that's going on. And we want to make sure that you're improving your understanding of the entire case. Okay. So if you're anxious about your future, if you're afraid about your child's education, if you're afraid about your retirement, and you're not living the lifestyle you expect, you can. And you can do it as a specialist, and you can grow your practice. How do we know?
We did it. And we've done it with many others.
That's right. So you don't have to feel this way. So when we came up with the 10 characteristics of the successful specialist, and by the way, there's really 17, but I only give you the top 10. Okay. Essentially, I created that in this book. So that would be a reason for you to get the book. Danielle and I wrote it, and some people actually think some decent things of what this book is all about. Former president of the AAP, Mike Rethman, Mark Weingarten, who is my age and has a practice now, has sold his practice, but he still is working for his associate, Sam Bikuria up in Pittsburgh. Tyler is the young periodontist who started with us right from scratch and did all of his he got his milk teeth, he got his real teeth with us, and we were there before he opened the office.
And doing great.
That's right.
Doing great.
And Ruben is also a young periodontist, and he's in associate practice in Dallas. And Ruben has done very, very well, and actually he's been a member of was the AIP and now the IDS from the moment we started.
Yeah.
So what do successful specialists have in common? Okay. Number one is the ability to have a conversation with a patient about the full case. The ability, okay? Now, part of the ability is what I said. It is probing, it is checking mobilities, it is looking at smiles, looking at bites, taking appropriate pictures, making sure we're taking full mouth series on every single patient. For most of our patients, we take CT scans. Okay, we do. And yeah, it's all included in our $79 examination. Horrors, I know some people are saying, because I paid $100,000 for my CT scan. Well, I spent $135,000 for mine. But it's there, and it's not costing me a dime to use it. frankly, it provides us with diagnostic tools. It shows people why they get recession in the anterior, why they need a free gingival graft. It isn't just loss of keratinized tissue. You have very, very thin bone in that area, which can help the patient understand why we might have to do soft tissue grafting, even bone grafting. Those people who do combination procedures with orthodontics and do PAOO, periodontal accelerated osteogenic orthodontics, this is invaluable information. So the CT scan becomes a valuable diagnostic tool for you, and it becomes a valuable teaching tool for the patient. So what do patients want first? They don't want regeneration of the pocket on the mesial aspect of tooth number 19, where I can do Emdogain and do a membrane or do a bone graft, and I can grow your bone back. They don't want that. That's on the way to this. It's on the way to the smile. It's on the way to chewing or regaining chewing.
Top 2 reasons. They want to smile and they want to eat something off the menu that they've always wanted.
Okay, we're also looking for pain sources and infection. I can't tell you how many times I've seen an apical abscess on my CT scan that I was never able to find. It didn't show up in the PA. And then finally, the periodontal condition. That may not be number 1 to you. It may not be number 4 to you. Certainly, it's number 1 to me, but the smile is number 1 to the patient. So what do? We take photographs of the patient. Yeah, photographs. Not just periodontal probing, but we have a photograph. We have a camera. We get it from Lester Dine. It costs $600, $700. We use retractors and we use mirrors in order to be able to give a patient a good view of what's going on in the mouth. So when I walk in, it isn't a full-on series of x-rays showing up on our 40-inch screen. What is it?
Their smile. Yeah. Up close, real big.
Yeah. Take that down. I don't want to see that. Hey, that's kind of important. That's emotion right there when the patient says that. Okay, what else do successful specialists have in common? They smile a lot.
Why are they smiling though?
Because they're happy.
Exactly.
They're having a good time.
And patients know that. Patients say that to us all the time. I love coming here because you guys are just so happy. The doctor's so happy. The staff is happy. It's a big point with patients. Big point.
What else? They're perceived as experts in dentistry. Now listen, I'm not a researcher. I'm not. But if we're talking about perceptions, essentially we're raising the bar for the specialist. So the specialist is the expert. The way you do that, we just covered that in a few webinars that we did for our members.
Yeah.
Essentially talked about the sequence that we use in the examination in order to be able for the patient to say, I've never had that done before. You must be an expert. And our examination takes how long?
For you, 30 minutes.
Yeah.
20 to 30 minutes, depending on the case.
Yeah. Yeah.
I mean, all these points that we're coming up are very much easier said than done. We get it. Like smiling, of course, easier said than done. You're not happy at work. You're grumpy at work because you're mad at your staff. Your schedule's not full. Part of becoming a member with the IDS is for us to guide you to that way of being happy and smiling. We're not just going to say, okay, you're a member of the IDS, you have to start smiling now. No, it's not that. We go over the foundations of what you and your staff and your schedule and your structure and your whole week, your everything. We kind of take it apart and we put it back together again for you and your team so that you can naturally come to work happy. And when you're happy, your staff is happy, your patients are happy, they accept, you grow. And same thing with, being perceived as the expert in dentistry. I mean, all this is something that, yeah, we write it down, but we show you how to get there. We don't just say do it. We're going to show you how to get there.
They work with office managers.
Yes.
Who have the same drive, the same ethics, same motivation as they have.
Right.
Do you know Danielle was my first office manager?
You never had one before.
Never had one. She's been my office manager now since 2005.
I don't know when I actually became an actual office manager, but I was first the surgical assistant, and then I gravitated towards the office manager.
Right. And by the way, she was part-time office manager while she was surgical assistant. So if you have a smaller practice, no, you don't need a full-time office manager. You do need to define what the office manager's role is, and you have to segment it. So Danielle had her time where she was office manager. She had time where she was assisting me. And so, and that was segmented time.
Right.
And there were specific things that office manager does. And in the smaller practice, you can get that done. You don't need to be full-time to be able to do that.
And one thing we do is this sort of training is I mold a manager for you, because a lot of times I get calls from doctors and they don't know who it should be. They don't know if they should hire outside, hire within, promote somebody. They have no idea. They're afraid of rocking that boat and making somebody, you know, of course, unhappy. So I do work with what is the best choice, and then I work with that person to mold them into that, because for us, an office manager is your sidekick. It's your person that you can talk to, vent to, unload to, give everything to, and go do what you should be doing, which is seeing patients, treating patients, doing surgery patients, new patients. You shouldn't be doing all the bills, accounting, payroll, problems, just solving, putting out fires, and you shouldn't be doing any of that stuff.
No, essentially I can concentrate on seeing my patients.
Right.
That's all I want to do. That's all I want to do anyway.
And that's when you start smiling.
That's right. Okay. They become part of a group of people that have the same goals as they do.
That's
so you can't do it alone.
Yes.
You can't. And so there are a number of groups that are like that, including ours, that, all right, common goal, common bond, common ideas. You're not going to take every idea that we have in our library and implement it right away. You may choose those things, but at least you see, and you're interacting with people on a level where you say, all right, I can strive for that. I can look for that. They're stimulating me to look at that now. I wasn't ready for that 6 months ago. I'm ready for it now.
And I can tell you, with every member we have, every doctor in every practice is different. They're not all the same. So we have all those different examples to share with you. So when you call or email and there's a problem, and we have doctors that call him and talk to him about issues they're having with staff or associates or potential associates or, you know, whatever. And I have lots of managers and staff to call me with staff issues, patient issues, just all kinds of, it's just nice to have someone that you can pick up the phone or email to say, okay, this is what's going on. What would you guys do? And if we have never went through it ourselves, which is, I can't tell you time that we never have gone through the same thing. We know of all of our members that we talk to, they've gone through it. So we can share examples, we can share ideas, we can go over things that you could do. It's just nice to have that resource of all the different periodontists around the country that have gone through the same thing you've gone through.
I'm Audra Ward, a periodontist from Overland Park, Kansas, and I'm a proud member of the IDS.
I want to do something for a second because you're not hearing that right now because I forgot to do something. Excuse me. I will be right back.
I'm Audra Ward, a periodontist from Overland Park, Kansas, and I'm a proud member of the IDS. I happened upon Lee and the IDS after I had posted a case to the AAP Open Forum. It was through that case that I found out about the IDS and Lee and what he has to offer through this group. I had just come off of coaching right before I signed up, and that coaching was very expensive, about $50,000. Coaching through Lee is much more affordable, and continuing to coach with my current group, who I really loved, was going to be $2,000 a month. For a fraction of that, I could have specialty-specific coaching through the IDS, and I can't recommend it enough for any specialist out there. It provides some of the best specialist-specific information that's available, and I highly recommend it. I'm Audra Ward, a periodontist from...
Sorry, Audra.
I'm Audra Ward.
Will I ever get past Audra? There we go. Next thing, they invest in their staffs. You know, whether it's sending out for continuing education, whether it's joining our group, whatever it is, it's an investment because the education that your staff is going to get is really going to take a lot off of your plate. You know, I remember when we first started this, remember we had somebody came to a conference we have a conference right here, an AIP conference. And we had somebody here who said, I want somebody coming to my office fully trained. Yeah, so do I. They don't exist. Even if they did exist, they're not trained like you.
And dental skills actually should be on the bottom of your list of things that you're trying to get for them, because you can train anybody on that stuff.
It's true. Essentially, we have, you'll see it later on, there's a library of over 100 training materials. And, a lot more than 100, because it's seminars, it's also written materials in order to be able to give your staff the opportunity to train. But they do invest in their staff. So we send our staff out for communications training, for sales training. There are a lot of things we'll send our staff out to do in order to be able to take advantage of other experts in the subject. Besides us, we don't know where.
Right. And we'll also show you other ways of investing in your staff, which is within your own roof of your staff meetings, communications ways to create an atmosphere that's ideal and pleasant and, of course, enjoyed by your staff. So there's lots of things that you can do within your own practice to invest in your staff as well.
Yeah, yeah, and they appreciate it. They really do, because then they feel they're contributing more, and because they are. Okay. They think of in terms of how can we do that rather than we can't do that. That comes from Dan Kennedy. And essentially, how can we do that? You look at something and you say, that costs too much, I won't do it. And by the way, if it costs too much and you really need it, essentially you're letting your practice drop. So then it is, how can we do that? Okay, what do we need to do in order to be able to reorder our schedule? What do we need to do in order to be able to increase our fees? Whatever it is in order to be able to allow us to do that. So if you're thinking in terms of how can we do that, you're in the right ballpark.
Yeah, I use that a lot when I'm working with your staff as well, because they don't like to think outside the box. It's very uncomfortable for them. So a lot of times with your staff, I do hear, we can't do that. We can't do that in this city. We can't do that in this town. It's different here. We're different. It's different area, different people. No, really, it's the same. It's just really how you're looking at it. So I do ask them that. It's not, that you can't do it. Let's think of ways that we can do it. And we always find a way to do it.
They inspire team members to take total responsibility for their positions in the office. Okay, that doesn't mean I'm micromanaging. It doesn't mean I'm running around seeing what this person's doing, what that person is doing. We set up systems, and actually Danielle has set up those systems for us. So while the job is there, the job is defined. We'll talk about this a little bit later on in the seminar. It's defined often in checklist format, so that we understand that it's going to be done. It's going to be done in a certain way, and the person's going to check it all the time.
Right. Exactly.
That way you've set the tone. You've also set the pattern for what you want, and then it's a matter of the staff member doing it and then turning the checklist back into the office manager. The office manager verifies that it's been done. Okay, a very good system. You don't see me on top of any system ever.
No, and staff really do like that structure, because when you put responsibilities onto each individual in their separate responsibilities, it's separate duties. You don't have the group effort with it. Yes, we have teamwork. We don't have groups of people doing the same thing, because then you have I did it last. I thought she said she was going to do it. She usually did. You don't have the finger pointing. Each person has their own description, their own duties, their own thing that they're doing, and they're in charge of that. So they just make sure that it happens. Very easy, very simple, and it works.
Okay, they accept criticism well. Danielle looked at me strangely when I wrote this, but every once in a while I do accept criticism from her.
Yes.
And I acknowledge it.
Yes.
More than every once in a while. And finally, they hire consultants. Yes. I have not met a successful practice yet that didn't hire a consultant. The outside viewpoint makes a big difference. Particularly the outside viewpoint that's trained in a particular subject in dentistry, who knows what others are doing and actually gleans from what others are doing, can provide you with an outside viewpoint that I never thought about that. And that I never thought about that can really make the difference in terms of hundreds of thousands of dollars for your practice. Mm-hmm. So here's the bonus one. They have a lot of fun at work. They run around. They sing. They tease. Whatever it is, I'll be careful about tease. Particularly in this environment, although I guess I get away with it more than...
he teases a lot. Tastefully teases.
Tastefully, okay. So let's talk about the IDS membership program, and you're going to see some also, even though we're talking about why become a member, you're actually going to see some tidbits here which will be important. So you're going to see still some teaching material. But if we look at how the program works, it's 2 webinars or podcasts per month, and you get that every single month. Podcasts are roughly 20 minutes, half an hour, something that's to the point.
Yes.
And so that's perfect for orientation for a new staff member, perfect for staff meetings, perfect for training both for your staff as well as for yourself.
Correct.
So let's take a look at one of those.
Dr. Sheldon Furtado's office. This is Jennifer. How can I help you?
Hi, Jennifer. My name's Joy. I was just calling to get some information from you. I'm kind of looking around to see if I can schedule a new patient appointment.
Okay, great. Right now we are running a special for $79 that includes a comprehensive exam, x-rays, CT scan if one is needed. What you got going on?
Right now I am missing a couple of teeth and looking to have some implants possibly done. I'm a little embarrassed about it. So I'm a little nervous about coming in. Could you tell me a little bit about how much implants cost?
Implants can start in the $2,000 range, but that's why we are offering that $79 special, because that gives you an opportunity to come in, find out what's going on, and find the alternative to treatment. Dr. Sheldon has been doing dental implants for over 25 years, and he has the best in technology. Do you prefer your appointments in the morning or the afternoon?
Well, I'm not quite sure if I'm ready to schedule yet. That seems like a lot of money for.
I understand. And the alternative to what before dental implants, a lot of people like to do a bridge. Bridge is going to involve 2 other teeth being compromised that may be perfectly good teeth in order to replace that missing tooth. And you're looking at a cost in the $3,600 range possibly for that bridge. It's not made to last forever, and you sound fairly young, so it's a good probability that you would end up having to replace that bridge down the road. So what kind of sounds expensive now with an implant overall is more of a better cost-effective way of replacing that tooth with not involving other teeth in the long run.
And financing companies are something you work with, or can payments be split up through the office?
We do have 2 finance companies. They offer 12 months without interest, or payment plans up to 60 months if that's need be with interest. So Joy, what was your last name?
Farrell.
Okay.
So we look at these. These are some of the training tools, and this is an excerpt, obviously, of how to answer the phone. Let's look at another one.
Dr. Sheldon Furtado's office. This is Jennifer. How can I help you?
Hi, Jennifer. My name's Joy. I was just calling to get some information from you. I'm kind of looking around to see if I can schedule a new patient appointment.
Okay, great. Right now we are running a special for $79 that includes a comprehensive exam, x-rays, CT scan if one is needed. What you got going on?
Right now I am missing a couple of teeth and looking to have some implants possibly done. I'm a little embarrassed about it. So I'm a little nervous about coming in. Could you tell me a little bit about how much implants cost?
Implants can start in the $2,000 range, but that's why we are offering that $79 special.
Let's move forward to the next one. So now we can look at another training tool here, and this training tool has everything to do with organization. How you set up organization in your office that's reproducible, and everybody knows what her job is and who she's responsible to make sure that job is being done correctly.
And we do, this is one of the webinars that we do have as far as the modules for staff training, whether it's new or existing. The phone module, which you saw, the one is one of many phone modules, because there's many different scenarios that your girls will tell you that it's difficult to handle on the phone, insurance and price and
do you need a root canal, or I need a root canal?
So on, yeah, there's so many different scenarios, and we've tried to come up with scenarios for each one of them. So we do have a whole section on the phones. This, which is organization and communication, this is something that you and your girls will build together. And of course, we will show guidance on that. This is where you have who is in charge of the area, and you'll see every single area of our practice on this paper, who's in charge of it, and then those who work with her in that department. So essentially every single staff member you have is in charge of something. So it gives them accountability, it gives them that responsibility. So it's another webinar that we do as far as how to design this, how to start this, and how to motivate your staff to be excited about it.
So as the manager of the practice, I make sure everything stays within our standards and within our policy. I also make sure that the tone stays high. Why? So we can all work together effectively, efficiently, get things done, attract the patient to want to be a part of our office, and to bring the tone up for the patient so that they're ready to accept treatment.
And to keep me in line.
And to keep them in line. All day long, this is what I do. So with these checklists, it's not to micromanage. It's for accountability.
That's the whole thing. It's not micromanaging. A person is managing him or herself. Sorry to interrupt you. You're on a roll.
Yeah. So it's all for accountability, because we do have, but even when we had 5 people working here, 10 people working here, but we do have over 20 people working here, this is so that I know things are getting done, and they know that I'm checking to make sure things are getting done, because people will skip corners. If they can find a good reason and convince themselves that their way is okay or better, they're going to do it that way. Not because they want to hurt you or your practice, because they think really it's going to be okay.
That's another example of another webinar we have on organization, is how to implement these check sheets. Who gets them? What should they say? What should they be about? And how to get them started. Our girls love check sheets. They feel more successful. They feel more accomplished. And they don't go home worried they forgot something, or wake up at 2 o'clock in the morning and realize they didn't turn something off or do something. So these are great to lean out areas, so you don't have wasteful steps, you don't have wasteful things that you're doing, and it also keeps your staff focused so they get things done faster. We have a whole webinar on that.
Let's look at another one.
So as the manager of the practice, I make sure everything.
So case acceptance is important, and we have a whole segment, we have a whole chapter, we have multiple webinars in case acceptance. And it's not just single case acceptance, it's multiple case acceptances, or a case acceptance of bigger cases. So then in fact you can deliver both for yourself as well as for the restorative dentist you're working with a good high-level treatment plan. So here's an example of at least part of that, part of one of the training tools.
The bone, and that way we know that the implant's ready to be used. If it's not quite yet integrated into the bone, then we shouldn't use it yet. That's how some implants fail, is that they get loaded too early. So we'll do that neat little test during that time, make sure all's good to go, and then we'll place the ceramic abutment. And the abutment, just so that you know when I'm saying this, you don't know the difference, some people use what's called a stock abutment. And this is it here, and you can see you have a lot of area around this abutment for stuff to get stuck down in there. And usually what gets stuck down in there is the cement from the crown when it goes to be cemented on there. This is what we use. We use a ceramic abutment. You can see it covers all that area, so there's not much that can be stuck around that area.
Much nicer.
Much nicer, yeah. Aesthetically, it looks nice, and it's a lot healthier.
Okay.
So that's what we're going to do there. So everything that you're going to have done there, this is your total here. It's $6,792. That's for the whole thing. This includes all your appointments, all your x-rays, everything until the treatment is completely finished, and you have that crown in there and you love it. It looks good. Okay?
And do I have to come up with all of that at one time?
Your options are this. One, you can do care credit.
Okay.
Care credit is dental financing, and they give you 12 months to pay this off with no interest whatsoever. Okay. If you want smaller payments, you can go all the way out to 40 months or so and have smaller payments, but the no interest is neat because it's kind of like free money. So that's your first option there. Nothing down, just payments for 12 months.
Okay.
If you don't want to do that, you can do half down today and half 2 weeks before the procedure, and that way you can break it up a little bit. Or my favorite, you could do the 5% discount because it saves you $340. That's a lot of money there. So you can save that money, and then you just prepay for the entire thing. It's already done, paid for. You don't have to worry about money for the entire time that you're doing this procedure here. So that would be your third option. So which one's more comfortable for you?
I'd like to take advantage of saving
Perfect. That's
5%.
what I would do. I would do the same thing. Gas is getting expensive again, so it's a good savings.
Yes, it is.
Okay.
So as far as case acceptance go, new patient experience, new patient examinations, presentate everything. I promise you, we have a library folder for everything that your practice deals with or is trying to get through, trying to improve. And this is a big one. This is the one that we work with a lot, and it's got lots of modules in it and also cheat sheets of what you can use to duplicate into your practice, and your girls can use them as well. So another one that we do is one on how to start and how to increase getting 5-star Google reviews in your practice. How do you get your team to help you get these 5-star reviews? Who's going to ask? What are they going to say? How are they going to get the patient to actually do it? Because those Google reviews really do help patients call your office when they look up dental implants or they look up missing teeth or replacing teeth or whatever it is. Your name comes up, they see that you have, 100 Google reviews, 200 Google reviews. How many do we have now?
207.
They see that you have a lot, and there's a lot of good ones in there. That, for us, we hear a lot of our patients say that's why they called our office. So we have a whole webinar on how you can obtain more Google reviews.
Actually, we have more than one webinar on that. So we have the manual way, which costs you nothing. We also have the automated way where you can sign on with a service. So
you, because it is helping us, it's helping us grow, and we want to help you grow. Some of our largest cases come from patients saying, I Googled your name, I saw your Google reviews, I read your Google reviews, I love your Google reviews, and I want to be that, I want to have that's what I want.
Yes, and like we said before, these webinars go for about 30 or more minutes or so, and we do design these webinars as a teaching webinar so that you can listen, watch, and definitely be able to copycat that into your practice. And like Dr. Sheldon said in the beginning, just simply use them as staff meetings. Play them for your staff and let them hear it. You guys talk about it, find a way that you can implement it into your practice. And if you have a problem doing it, just email us, just ask us.
You, because it is you.
okay, so the next part is actually as important for, in fact, maybe more important for some practices. You get in trouble, all right, what else do you get? Well, you get the opportunity to email us with whatever question you have, either on a lesson or whatever is going on in your practice. And there's some practices that take major advantage of that.
Right.
There's some practices that some doctors contact me, many staff members contact Danielle, and you have that opportunity as part of the membership.
Absolutely.
There's the Monday Morning Minute, and this comes into your email box every Monday morning, and here's an example of one.
Good morning, members. This is your Monday Morning Minute. All of our members know how much I love checklists. I love check sheets. Why? Because it keeps everything in the practice running according to policy and structure and standards. I recommend these checklists for every single post in the practice. That way, if somebody has to fill in or help, they just pick up these checklists and they can do all the duties that pertain to that post without any forgets, and things just keep on running. I do recommend that you have every staff member that is responsible for their areas, that sit in these areas or work these particular departments, to write down a checklist of how they start their day, how they do different procedures and appointments in their day. For example, how to do a post-op appointment, how to set up for a new patient appointment, how to answer a new patient phone call, how to schedule a perio maintenance appointment, also how to end their day, what to do before you leave. Also, in addition, you can have the person responsible for the areas create an end of week check sheet. So it's how to end your week, whether it has to do with stats, how many patients you saw that week, how much you collected, how much production, or it's end of week as far as maintenance, to clean different areas of the rooms or the sterilization room, end of the month, which is different reports.
So these Monday morning minutes are not so much designed to teach you how to do something. It's to give you an idea of something you could use in your practice. And then we have members that contact us and say, tell me more about these checklists. And then we can either share a link with you, or we can talk to you about how you can do it as well. So we try to keep these under like 3 minutes or so you can listen to them on the way to work and go, oh, I love this. Pass it on to a staff member, manager, have them listen, have them contact us, and then we can provide you with some more information.
Good morning.
Okay, and then there's the full library of IDS materials. Now, we've been doing this for 5 years. You can imagine how big. You don't have to imagine. Let's take a look at the library.
Lots of stuff in there.
So this is our new format. This website is being rolled out. We do not have this available. We have it on Google Drive right now, but it's the same information. And essentially, you can take any area of the practice, click on that section, and you're going to see all of the different lectures, all of the different written materials for each of those things. In addition, if you're giving it or doing it as a course, you can keep track of how many you've listened to. So you start off at 0% complete. When you've done 100%, it's the module is keeping track of that for you. Okay, internal marketing and all of the different things that you can implement for very, very low cost in order to be able to get patients to refer new patients to you. And all of the strategies that we have here, Charitable Giving Campaign is a fantastic strategy. It's working very well, not only for us, but for everyone. Right. Phone modules, which we already talked about.
Yes, absolutely. And we have set these up in order of importance. So as you go through, it's the stuff that, of course, matters the most. Your first 1, 2, 3, 4, 5, of course, are the ones that are the meat of it. The rest is a lot of supplemental stuff, even older stuff. But we kept it in there because it's all good stuff, even stuff we did 4 years ago, and it was a teleseminar. It's great information. It's good stuff in there. So like we said, we do have unlimited email support. So if you have some questions on it, just let us know.
And even for office managers, we've got a separate section for office managers to teach your office manager to be an office manager.
Absolutely.
By the way, you probably have a budding office manager working in your office right now.
Yes.
Okay, block scheduling, how to make sure that you've designed your schedule so the schedule is productive every single day.
And consistent. Yeah, so with this one, you can decide how many new patients you want to see per day, per week, per month, how much production you want to do per day, per week, per month, and how many post-ops do you want to see, and have full control over that. We have 5 days that we're open here, and each day is blocked and templated differently depending on who's here. What does he want to do? Maybe we do surgery in the morning, new patients in the afternoon. Maybe we do new patients all day one day. But each day, each Monday, each Tuesday, each Wednesday, they're all the same with using the block scheduling. And that way, basically, your staff is doing plug and play so that you don't have different stats every single week and wondering, why is my new patient count low? Well, maybe because somebody just filled holes and you have a bunch of production, but no new patients, and now you have no money coming in. So it's just a way to control what you have coming in and out of your practice.
So that's an example of some of the materials. Let's listen to some members and see what they have to say.
Good afternoon. I'm Kenny Levina. I'm a periodontist in Tamarack, Fort Lauderdale, Florida. Next month, we'll be celebrating being in my office 43 years. Things have changed in the world of perio as we all realize that patients are no longer coming to us from referring doctors. As a result of the things I've learned from Lee Sheldon and the guidance that he has provided, we are now independent of the dentists in the community. As a result of the things that he's taught me, and things like our magazine, 90% of our patients that we treat today do not come from dentists. Now, I have become the source of new patients to the dentists I choose to work with in my community. This is an amazing, amazing feeling, different than what we had for the previous 40 years in practice. Now we are independent, We are the masters of our own destiny. I look forward to doing this for many, many more years in the future. Thank you.
And so let's look at someone who is in a different category.
As far as what I would tell others for the Institute for Dental Specialists is it's really a must in today's dental and periodontal market. If you want to be competitive, if you're looking for a way to get out of the situation you're currently in, if you know there's something better, or if you're a seasoned veteran and you're looking to change your practice because maybe referrals are dropping off, maybe that you know that there's a change coming on the horizon, and if you want to make that change, the IDS is the go-to group to make that happen.
So we've got the full library of IDS materials. So what does that involve? The webinar is $297 a month. There's no contract. People will join for as long as they want to join. Some have been with us for 5 years. Some frankly stay with us for a year. They say, I've gotten all I'm going to get. That's it. But you can even try it for a month and just see what you think. And of course, during that month, you have the entire access to the entire library of materials, so you can look at everything.
Yeah.
Everything we've done.
Most of the periodontists just stick with us because it's nice just to have that outlet to go to. It's nice just to be able to ask us a question through email, through phone, or just have the library in hand. So when you do have a new hire or a staff that's not performing, the way that they should or doing something, just give them some assignments. It's just easy to have that at your fingertips.
So how do you do it? Here are all the ways. You can go to the website, directorofdentistry.com/membership, and you'll be able to sign up that way. If you want to get an application, just send it to the email address, lee@directorofdentistry.com. And if you want to talk with Danielle,
call me.
So all of those, you've got all of those ways of contacting us. We hope you've gotten a lot out of this. If you have any questions, just email us at lee@directorofdentistry.com. If you have questions about membership, questions about your practice and what the IDS might be able to do for you, we're happy to respond to those emails, and certainly those who want to just talk and want to talk for about a half an hour and see what your practice is all about. Share with us what your problems are, and interview us and see if there's something that we might be able to do to help you. There's a number of different ways we help besides membership. We do consulting both on a limited basis as well as a full-time basis for specialty practices. So just let us know how we can help you. Just give Danielle a call at that number, and we can set up a phone consultation, or just send us an email. We can set up a phone consultation for you as well. Anything else that we missed?
No, thanks for joining us tonight.
Yeah, good. Look forward to hearing. So, good night.